Hi everybody, it's Cindy from Midland Physical Therapy again. Today I want to talk to you a little bit about rotator cuff or shoulder problems. So you've heard a lot of information about rotator cuffs or about people having torn rotator cuffs and having to have big surgeries in their arms and pillows and slings. So I want to talk a little bit about not so much tears or massive tears, but more of shoulder pain and the different reasons you can have shoulder pain. And in specifically, there's one very common reason for shoulder pain, but it does include your rotator cuff. So the rotator cuff is a group of 4 muscles that are attaching to your shoulder blade and to your long arm here, your humerus. And what happens a lot of times is there's a part of the rotator cuff or a tendon that runs right under this tip of the bone on your shoulder. It goes through there, and there's situations where we are reaching and lifting with our arm extended, or we might be doing something overhead and putting too much pressure on that area, and it causes a tendonitis. So basically what I'm talking about is impingement. Impingement basically means pinching. So just as you can bite your tongue with your teeth and you can have a swollen tongue, you can pinch the tendon in your rotator cuff and have a swollen tendon. And if you have a swollen tendon, when you start to reach and grab things and lift them, you can have more pain, more inflammation or swelling, and you're just miserable. Doesn't mean you have to have surgery. So I want to give you some points about how to avoid doing that or getting it pinched, and then if it is pinched, how to position or how to properly lift so that you don't aggravate the condition. So one, when you're lifting, you don't want to take that tendon and go out like this and pull on something or lift something. If you're going to lift, you want that thumb up in the air, so the arm is like this to your side. Use your bicep muscles here and lift with everything close to you. That puts less pressure on that tendon. The other thing you want to avoid doing is sleeping with your arm over your head. So if my left shoulder's hurting, the last thing I want to do is this, because you can imagine I'm bringing that shoulder together when I do this, and that tendon's going to get pinched in between those bones. So if you're sleeping and you go like this, you're going to have to find another position. So what I'd recommend is taking a pillow, lay on your side. Don't lay on the side that hurts. You need to try to lay on the other side. Take that pillow, place it under your arm like this, so that it is propped up, so it's in a natural position. You don't want it folding over, because that is the area of pinching when I roll my arm in. So like this is more appropriate, or if you don't like that, you can put a couple of pillows here, bend the elbow and keep it propped up like this. Okay? And then the other thing you could try to do, if you're symptomatic, it feels good to take that tendon and put some pressure downward on the shoulder, in other words, some traction to help relieve the pressure. So what I've got here, can of soup. I'm just going to bend over like this at a table. I'm going to take that finger and thumb like this and hold it, and I'm just going to let it swing. And so what I'm doing here is I'm taking my long bone of the arm, and I'm pulling down using the soap. I'm using this the can of soup, and I'm pulling down, allowing that shoulder to give that tendon a little bit of breathing room, and do that for a minute or two. Completely relax your shoulder, and that will help. So that's it for today. Talk to you next time.